Good morning. Welcome everybody to our webinar today. The topic today is Transplant 101, Preparing for Your Journey. I'm David Douglas. I'm the chair of Transplant at Mayo Clinic. We have transplant campuses in Rochester, Minnesota, Jacksonville, Florida, and Phoenix, Arizona. Today we're joining you from the campus in Phoenix, Arizona. My co-presenter, Beverly Hansen.
I'm the manager of outpatient social work here at Mayo, Arizona.
So the format will have some slides and some background for the first 30 minutes or so, and there'll be plenty of time for questions and answers at the end. We'll go to the first slide. So our goal today is just to kind of give you a little bit of background on once you realize you need an organ transplant, what's the next step? What are you going to do from that point on? We'll talk a little bit about how you can choose a transplant center. I'm going to show you some information out there. It's on the web from the SRT website, and we'll go through that a little bit. And then we'll also spend a lot of time talking about just the whole process, you know, the selection committee, what happens when you get chosen to be a transplant candidate, what can you expect from your transplant center after that. So first, I just want to give a little bit of background. A lot of times there's misperceptions on exactly how once somebody's on a transplant list, we'll talk about the process of getting on the list. But once you're on the list, how are organs matched? How are donors found? And this slide just kind of gives a high-level overview. Once you're identified as a recipient that needs a transplant, you'll be referred to a transplant center and go through an evaluation there. At the transplant center, if you're approved for a transplant candidate, you'll be put on a list. And then that list is managed by United Network of Organ Sharing. That's what we call UNOS. And on the other side, when a donor is identified, you'll hear me talk a lot about organ procurement organizations. OPO is the abbreviation we use for that many times. They're the one that coordinate all of the donor activity within their service area. And so when a donor is identified, that information also goes to the UNOS Organ Center, and that's where the matching of a donor and a recipient actually occurs. The next slide again just kind of shows a schematic that kind of emphasizes that once a donor organ is identified, they look at all the potential patients waiting on the list, and then there's a national computer matching system that matches the characteristics, identifies the best donor for the recipient. There's a match list that's generated. And that's another perception is that that match list is a very organized and systematic way of matching. Just because somebody is a celebrity or if someone is rich, they don't get any more priority on the list. The list is set, and we go down that list as far as organs being offered to someone who's in need of those. So a couple of other things you'll hear me mention. I mentioned Organ Procurement Organization, or OPO. Another term you'll hear me talk about is donor service area. The United States is divided up into 58 donor service areas, and that's where the OPOs coordinate the donor activity. So you can see the map here. It's some of them are along state lines, other ones are spread out in different geographies. For instance, if you're in Rochester, Minnesota, that donor service area is Minnesota, but it also includes North and South Dakota. Here in Arizona, we're in donor service area 54, and our OPO encompasses most of the state of Arizona. So it's just important for background information when I refer to donor service area, OPO, or local, this is what I'm referring to. Donor service areas then are divided into larger areas, regions. And you can see there are 11 regions throughout the United States. Most of them are along state lines. This is important, and we'll talk a little bit more about this, but sometimes there are some geographic differences in regions as far as how quickly someone might get transplanted in one region versus another. This is more noticeable in liver transplantation. There's been a lot of discussion about that. There are currently a lot of looking at new policies to make it fairer across the United States. But we'll talk a little bit, and I'll give you an example of how you can use a tool on the SRT website if you are waiting for a liver transplant to predict what your chances of getting transplanted might be within your donor service area, within your region. And we'll talk a little bit more about that during the presentation. So I think once you're identified as a transplant patient, whether it's going through the evaluation, whether it's on the waiting list and waiting for a transplant, whether it's actually getting the transplant and then recovering after and long-term follow-up, The relationship you develop with your transplant center is going to be very important. You'll also have a very strong relationship with, obviously, with your referring physician and your case manager from your insurance company. And that teamwork between the transplant center, your referring physician, the case manager, and you as the transplant patient is going to be important, and one that really lasts for the rest of your life, because we always manage immune suppression after your transplant. So the question kind of comes up: how do you choose a transplant center? And again, your referring physician, your case manager may have make some recommendations as far as the transplant center, but there's also some other good tips that I wanted to discuss. In my opinion, I think good communication is the key. You want to be able to get a hold of your transplant center 24 hours a day, 7 days a week, 365 days a year. It's also important to know what your transplant center's selection criteria are and what their contraindications to transplant are. Those may vary. They may not be the same from one center to the other. There are some centers that may be a little more aggressive and a little more aggressive on donor selection, or a little more aggressive on recipient selection. Other centers may be a little bit more conservative. So it's important to kind of know what your transplant center's criteria are. Another important consideration is, does your transplant center offer living donation? We'll talk a little bit more about living donor in the second part of the presentation, but living donor is usually for kidney and liver. But if your program does offer living donation, it gives you more opportunities to be transplanted. So we'll spend some time talking about that.
And Dr. Douglas, I think another aspect too is that their own insurance could be part of determining which transplant center
Absolutely.
they would be eligible for.
Right. So your case manager will may very well recommend where you go for your transplant. Transplants are very public. The outcomes of transplant are very publicly reported, and I'm going to show you a couple of websites that you can go and get a lot more information on your transplant center, and this may help you or your insurance company choose the transplant center that you go to. One of the websites is OPTN. You can see it listed there on the bottom. That website's a government website that has all the transplant centers in the country. You can see how large their waiting lists are. You can see how many transplants they've done, and that information is updated every few months, so it's very current. The second website that we're going to talk about is the SRTR. That stands for Scientific Registry of Transplant Recipients. This is a website that is updated every 6 months, the outcome data. So the last report was released in January. There'll be a new report released in July. And that website has a lot of information, and we're going to spend a little bit of time just kind of going through that and showing you how to navigate that. So I'm just going to click on the hyperlink here, and this will bring up the website. So this is the home page of the website, the Scientific Registry of Transplant Recipients. Again, they spend a lot of time on this website making it very friendly, user-friendly, and there's a ton of information on here. We're not going to be able to cover all of it in this short webinar. I do encourage you to go to the website, explore, learn how to navigate through it. I'll give you a couple of examples today, but there's a lot of information on every transplant center in the country. And again, this is updated every 6 months. So this information we look at today will be January's report. July the 6th, there'll be a new report that will be released. So at the very, so again, another thing, if you go down on the website, you can see an OPO report. And so I mentioned that donation service area, those 58 donation service areas, the 58 OPOs. If you want information on your OPO, how many donors they had last year, where those donors go, you can click on there and get a detailed report, a 30-page report of the individual OPO within your area. Also on here, you can see there's a hyperlink down here for Organ Procurement and Transplant Network. That's that other website that I mentioned. And so you can click on that and go to the government website and see information on individual transplant centers. But what we're going to spend most of the time on today is the SRTR website and how you can compare different transplant programs based on outcomes, transplant rate, waitlist mortality, things like that that are very important for you as a transplant recipient. So in the very first here, you can see if you select organ, you can click on that and it lists whatever organ you may be interested in looking at and getting more information on. For an example, I'm just going to choose kidney first, as it's the most common organ that's transplanted. Next, you can put in your zip code, and it'll tell you about all the transplant centers that are located close to you. If you don't put in a zip code, then it'll give you a national search. And so you can just default to national. And for the example, we're going to use that as kidney national, and we'll just hit search. So now what comes up is a list of the kidney transplant centers. You can see that this is a national search, so it lists all 269 kidney transplant centers in the country, and it lists them, it ranks them in order by outcome assessment. So the SRTR website, what they do for outcome assessment, they look at 1 year graft survival. That means the chances of you being alive at 1 year with a functioning transplanted organ, and that is the statistic that they use to rank the programs currently in the United States. For the kidney programs, I mentioned there were 269 kidney programs. There were 8 programs that were listed as better than expected. So that means that statistically they have outcomes that are better than expected. That means that they just didn't happen by chance. After those 8 programs, it'll list all the other programs that are as expected, and their results, again, are in the as expected range. And at the very bottom of the list will be the handful of programs that are statistically worse than expected. So maybe they've got some problems with their outcomes, and you might want to know, why that is.
So, Dr. Douglas, will it say then why they have lower numbers?
It'll have the patient survival, graft survival, but it won't have the reason.
Okay.
But every transplant program is required to give you their SRT outcomes when you go through the evaluation, and then you can ask those questions at that time as far as why that might be. And again, these results change every 6 months. That's important to realize. So in July, there'll be a whole new set of numbers, a whole new set of rankings. So you can see for kidney programs, so in this column is the outcome assessment. Better than expected, expected, or worse than expected. Next column is transplant rate, and so that's expressed as per 100 patient years on the list, and so that tells you kind of what are your chances of being transplanted at that program. And then the next column is transplant volume, how many transplants they performed in the last year, and then there's a distance. If you put your zip code in, it would give you the distance from your home zip code, how far that program is from you. And so here you can see the programs listed. The program, the kidney program in Rochester, Minnesota, is rated as the top kidney program based on outcomes and volumes. Another example, let's just go to heart programs. And so again, we'll click on this. This gives us the national search for heart programs. You can see here that there are 142 heart programs in the country. Again, it's based on outcomes. You can see that in the heart programs, for the kidney programs, if you remember, there were 8 programs that were statistically better than expected. For the heart programs this semester, there's only 1 that's statistically better than expected, and that's the heart program here in Phoenix, Arizona, at the Mayo Clinic Hospital. Again, transplant rate and the number of transplants performed last year. If you wanted to know more about your state, you could click on state and just look at the programs within your state and click update. If you wanted information on pediatrics, you could click on adult versus pediatric and click on pediatrics. And if you wanted to know your zip code, I'll just put an Arizona zip code in here and update it, and you can get information close to your zip code, and you can actually click up to different ranges of miles, up to 750. And you see in that situation now it shows you how far this transplant center is away from your home zip code that you put in. So this is a good overview of all the programs. You can look at programs close to you, your zip code, your state, or nationally. If you want more information on an individual program, you can click over here on these hyperlinks. The view summary data will give you a one-page summary of kind of summary information of that program. If you click on complete reports, that will give you a 30-page detailed report on that program. So we'll just go to that. So again, this is a lot of information on the program. It's 30 pages. I'm not going to go through the whole report, but I just want to show you a couple of items within the report. The first 2 pages are really just kind of an overview. And then after that, there's a table of contents. So it tells you what page to go to for the information that you need. And if you go to the very end of the report, there's a scattergram report. I just wanted to kind of show you that. So the scattergram report is patient survival and graft survival, and it's for different time periods. So there's a time period of 1 month, 1 year, 3 years. And again, that's updated every 6 months. But this just shows you the program you're looking at will be highlighted in blue, their dot, and all the other dots represent all the other programs in the country. Volume is shown on the bottom scale, so you can see that the scale, the further the dot is to the right, the higher the volume the program is. So for example, this is the Arizona Heart Program, and over this 2.5-year period of time, they did 86 transplants. The other important thing is this line that's in the middle of the diagram. The line is an as expected line, so if your dot is below the line, you're better than expected. If the dot is above the line, then you're worse than expected. And again, you can see here that this is the blue dot is the Arizona Medical Center program, and it is better than expected and high volume. And for this semester, had the best results in the country. And again, these are updated in July. So that just kind of walks you through a few of the things you can look at with the SRTR report. There's a lot more information here in this 30 pages.
I think that's good too, that there's so much information on the web that we tend to want to try and find out information, but going into SRTR is just such a great, concrete, definite information, and it's very current and valid. So I think that's really important.
There was a survey on UNOS about people that go to the UNOS webpage as far as how many people use this information. It's actually a fairly small percentage of patients, maybe 40% at this time. So I think it's something that we do want to get people the information out there. I don't think a lot of people are even aware that this exists out there. There's one other tool that I want to show you that's just for liver transplant at this point. So this on the web page, again, the front page, if you go to Report and Tools, and then you go down to the bottom section on Tools, so this is a tool that the SRTR has come up with. As I said before, the geographic differences are the greatest for liver transplants. And so right now they've come up with this tool for liver transplant. They may be working on it for other organs in the future. But this is designed to kind of let you know what the chances of you getting transplanted are at any particular program in the United States, any particular region, any particular DSA. It's based on information that's occurred over the last 2 years. And so you can look at it and get some idea. So sometimes some of our patients find this to be helpful as well. So if you click on that diagram, it will load. And then so again, you can tailor this to what information you want. You can put in the state that you're in. So we'll put in Arizona since that's where we are today. You can put in your transplant center. We'll put in Mayo Clinic Hospital. You can see that the 4 transplant centers in Arizona are all listed there on the drop down. You can put whatever your blood type is. We're going to put in O. It's the most common blood type. And then you can put in your age category. We'll put in just all adults over 18. And then you can put in whatever your MELD score is. So you can see here, we'll just 25 and 29 is kind of the middle of the range. We'll put that in. And then showing all patients within this MELD range. You can select if you want just patients that have exceptions or patients without exceptions. And then what period of time you're interested in, we'll select 90 days or 3 months. And so what that gives you then is the graphs over here. And you can see the top graph is the transplant program that you're pulling up. So here would be Mayo Clinic Hospital here in Arizona for liver transplant. You can see that over that 3-month period, 54% of the patients received a transplant and 45% were still waiting. You can compare that to other programs in the DSA, and that's the second graph. So the second graph shows 17% of the patients within the DSA are transplanted in that same time period. The third graph is in the region. So for us, that'd be region 5. You can see that 8% of the patients are transplanted in that time, 82% are still waiting, and 5% died or were too sick for transplant. And then the bottom one is the national data. So again, This is just an example. I encourage you to go if you are waiting for a liver transplant, you want more information, you can go to this site to get more information. So again, that was a lot of information to go through, but I just want to give you some examples and encourage you to go to that site and find out more for yourself.
So now, hopefully, after you've done all of that, you've determined what transplant center you are going to be going to, you'll be getting a phone call from the transplant center to help set up your evaluation. Here at Mayo, Arizona, we tend to do it all in 1 week and all very concentrated. But if you're still working and need to spread that out, that is completely fine. It's an intensive week of tests, very, very thorough. And you'll be meeting with a whole multidisciplinary team. You'll be meeting with a doctor, a surgeon, a nurse coordinator, social worker, patient financial consultant, and a dietitian. I think what's so important to remember in that week of evaluation, Dr. Douglas, is it's pretty intense. There's a ton of information, but really our goal is your goal. You know, we want you to get that transplant. So the reason for this very thorough testing is we want it to be a successful transplant, and that's kind of the key. And unfortunately, not everyone is eligible for a transplant, but we do as much as we can to get you to that point of transplant.
It really can be overwhelming that week, and we certainly encourage you to always stop and ask us questions anywhere along the pathway. If you don't understand something, stop and ask us and get more information.
Exactly. There's a lot of conversation going on during that week. There's classes. So we really try to have that conversation with you and be able to ask questions. But part of that is something that's really essential is every transplant center will ask that you have a caregiver. That caregiver is your eyes and ears through the whole process. It's so key. So as you're coming in for this evaluation, there's so many things you're being told. Having someone to write down notes, to ask questions. You may be feeling fine and not feeling real sick yet, or you may be feeling really pretty sick. Either way, having that person alongside you to ask those questions is key. That caregiver is going to be your support through the process. They're going to be there at time of transplant, where they're going to be really there a lot in the hospital, where we're going to teach them all the meds you're going to be on, how to take the blood pressure, how to, just be there to make sure that there's not any concerns when you're not here at the clinic. They're going to be your driver. They're going to do your cooking, your cleaning, your laundry. You're going to have lifting restrictions, which is why they're going to do a lot of that for you. You're going to be on new meds. So we want to make sure that you're taking those meds at the right times and right dosages. So that's going to be a big role of that caregiver as well. And then, of course, bring you to all your medical appointments. Length of time a caregiver is needed kind of varies by organ and even a little bit by center. Kidney and liver transplant, really about anywhere from 4 to 6 weeks, sometimes 8 weeks. Heart and lung could be even a few months. So we are asking a lot. There's no question. We are asking your caregiver to kind of put their life on hold for a little bit and be there to help make that transplant successful. I don't know, Dr. Douglas, I know you've seen this, is the times where someone has had a transplant and for whatever reason, because we know life happens, their caregiver wasn't there. But I think it makes such a difference on the success of the outcome and how well they kind of facilitate through post-transplant. Would you agree?
It's a huge difference in having a caregiver and even a team of caregivers.
Yeah.
Sometimes it takes a village to take care. And it's also a hard job. Being a caregiver is probably as hard as being the recipient and going through the waiting process. And so we even have support groups for our caregivers.
We do.
To try to provide support for them through the process.
That's exactly right. And we will be asking for a backup caregiver because, like I said, we get that life happens. So we will be asking that you have backup caregivers in case your primary cannot be here. So it comes time and you're going to be meeting with the social worker, but we're going to talk about possible relocation, especially if you're coming in for a heart transplant or lung transplant or even a liver. We don't want you in another state where you're hours away. We may ask that once you get you're essentially getting a little more sick, getting closer to time that you may be called in for that transplant, the social worker will work with you to how you can relocate and so that you are available for when you get that call. And once you have that transplant, then we do want you to stay within about an hour of the transplant center because you're going to be in a lot of medical appointments and back and forth. We'll be meeting with you on if you have a transplant benefit through your insurance. And we also have the transplant house. And boy, I tell our patients it's more like a bed and breakfast, because it's such a relaxing, wonderful place to heal. And it's very low cost, and it's just a great place. Plus, it's right here on campus. And of course, you may choose to just rent or even stay in a hotel. Another concern that many patients have when they're thinking about transplant is the financial, and what does this and how's it going to impact me? So we're going to spend time with you with how does it affect with your work and your missed income. We'll talk about disability. We'll talk about Family Medical Leave Act, which basically means that you have up to 12 weeks that you can just essentially guarantees your position at work. You don't get paid through the FMLA, but it does guarantee that position. And then, of course, we're going to talk to you about fundraising. We have a couple of great websites and organizations, Help Hope Live and the National Foundation for Transplant. They are just, they're excellent. They will actually help you fundraise. They keep the money in kind of, so they can kind of take care of it in the sense that it's not included as income for you. So many people are aware of the GoFundMe, and that is included as income. So what's happened to a couple of our patients, unfortunately, is they had Medicaid, and that put them over the income level, and they lost their Medicaid. Emotional and social support. It is, like Dr. Douglas said, it can be emotional time for both you and your caregiver going through this. So we have support groups out there. We have liver and heart transplant support groups for patients who are both listed as well as post-transplant, and they truly support each other. I think one of the important things to remember is we tend to be in a atmosphere of we can do it ourselves. And truly, as you're coming through for transplant, you know, if your Aunt Mary says, you know, I'd love to come by and clean your house, start saying, yes, I would love that. If you have friends that want to bring meals, do that. We had a patient who his church group wanted to bring meals, but you know, they're immunosuppressed. So having people in and out of the house is a little difficult. So what he chose to do was the caregiver had a cooler on the patio. So every day someone from the church group came and brought their meal, and that was great. So the thing with that too, Dr. Douglas, I find is that those who help feel like they're part of the transplant. So you're really getting blessed as a recipient, but also that person who is helping is blessing. One of the things that we do here at Mayo exceptionally, and I've worked here 12 years, and I have to say, I still get goosebumps when I sit in our selection conference. I wish our patients could be flies on the wall. During this conference, we have everyone there, the whole multidisciplinary team. But where my goosebumps come into play is that these world-renowned doctors and surgeons truly spend time and passion and care trying to determine, is this the best course for this patient? And the amount of time they spend on each and every patient and having that discussion and listening to what the rest of the team says and their thoughts about it, I just think is pretty amazing. It's very patient-centered, and I think it's something we do quite well. From that selection conference, you're going to get one of 3 outcomes. Hopefully, we'll be calling you and letting you know that you are approved, and we will list you on UNOS, and then you start the waitlisting process. You may be deferred, which means basically there may be some more medical tests that you'll need to complete, or it's possible that it could be a psychosocial reason that we still need a caregiver plan or something. Or it is possible that you will not be eligible, that the team feels that at this point it's not safe or to your benefit to pursue a transplant. Of course, at that point, you can pursue another transplant center. So you get listed. Now what happens? Well, you may be listed for just a few days, or you may be listed for a few years, but it really is a good time to prepare. So fundraising, starting to save, build your support system, talk to your caregivers, and really taking care of yourself, both emotionally but physically. The stronger you are in all aspects, the better that transplant will go as well. So it's important to just, try and take care of yourself. It's also important, and this is something you and your caregiver could do, but let us know if there's any changes. Certainly, if you have a change of cell phone number, We need to know that. So at 3 a.m. when we call you for that transplant, we want to make sure we get a hold of you. And so any changes, insurance, address, if you're in the hospital, it's all important things to be able to tell our team so that we can make sure that you get that. And then as Dr. Douglas alluded to, we have a living organ donation. So here at Mayo, Arizona, we do both kidney and living organ donation. Basically, anyone over the age of 18 who is relatively healthy. And by that, I mean, you really, as the recipient, don't need to determine that. You can actually, if someone is interested in being a donor, we will follow up with if it is appropriate for them to be a donor. They get very thorough testing. There is, they do not pay for any of the medical care, so the whole workup, there's no charge, nor is there charge for the surgery itself. But they are responsible for travel, lodging, food, but it's totally fine for the family and friends to help with that. It just becomes illegal if the donor starts to make a profit. So of course we don't want that. But there are a couple websites and organizations that help with missed income and travel, which are on the slide: the National Living Donor Assistance Center and the American Transplant Foundation. Both are excellent, and your social worker can help that donor work through that process and do the application. So often I hear, Dr. Douglas, I hear patients say, I just don't want to burden my family, and I don't want to burden my friends. And I get that, but I have to let you know, I'm a kidney donor myself. I donated 4 years ago. And honestly, I can say that's one of the biggest privileges in my life. I had the privilege to donate to my cousin, and it's something I wanted to do, which I think is key for a donor. If they ever feel pressure or feel coerced, it may not have a very good outcome. But for those donors, and there's many out there that want to truly help someone in their life, it is a great privilege. It's been 4 years. I cannot even tell I ever donated. I love to downhill ski. I hike. I am just as active as I was before, and my lifestyle hasn't changed. So it's been a blessing. And 9 months after the transplant, in fact, they had twins. So I stay very close to them and have even a tighter bond with them. So what you can do, though, is you can designate a champion if you're not comfortable. That champion may be your spouse or your adult child, and they can be the one talking to friends and family via Facebook, via email, to just kind of say, you know, my loved one's listed and now is ready for a transplant and may be eligible for a living donor. So, so that's.
A lot of times people just need information. I mean, a lot of times people are willing to be a living donor, they just don't know that it's an option.
Boy, that's
and sometimes they just need to know that it's out there as a possibility. That
is so true. And just kind of knowing some facts about it, you know, and you know, what are the costs to it? And, you know, so we'd love it. If anyone even is thinking about being a donor, they should give us a call and we can answer any of their questions. There's also an online form where they can submit a health questionnaire just to see if they would be eligible. And it is, it's what we call our Breeze. And I think it's livingdonormc.org. And that's a great way to start the process for anyone who wants to be a donor. So then, and next, what happens after transplant? Well, you're going to have a lot of appointments. We do follow up closely with you in the clinic. So just being there at every lab, at every doctor's visit, having your caregiver follow up and be there with you is important. And, you know, being compliant with your meds, being compliant with the appointments, and also communicating with us. You know, I know we sometimes will have kidney transplant patients who are so used to not taking any liquids in because of dialysis that now we're telling them to drink the fluid, and that's kind of a tough transition for them. And so the doctors have a great way of kind of explaining why things are so important. But truly, the goal with everything with transplant is we really want you to get on with your life. We want you to have the transplant and continue with your bucket list and enjoy your family. So that really is our goal, and I know it's your goal as well. So we are approaching April, which is Donate Life Month. And they have a Blue and Green Day, which is April 21st. But it's really just a time that we can appreciate our donors, that we can appreciate families of deceased donors, as well as our living donors. It's an opportunity to go on Facebook, update your Facebook cover photo. On the National Donate Life Month Twibbon, you can add your profile as well. So there's ways to get involved. You can just go onto the Mayo Clinic Connect and find out ways that you can participate in various Donate Life activities.
And if you haven't registered already to be an organ donor, we certainly encourage you to do that. Go to your state website, there's registries, and you can also express your wishes to be an organ donor is important too.
Yeah, very much. So we would love some questions and discussion. Certainly I've enjoyed this time to get to share what transplant is and the journey. Do you have any questions, Dr. Douglas?
Yeah, so there are a few questions that have kind of come in, so we'll start with those. If you have your questions, please submit them, and we'll try to get to them in the remaining time. So one question was, I was denied for a liver transplant center closest to me. Is there a chance another transplant center might list me? I think like any medical condition, it's always good to get a second opinion. And so again, it might depend on the reason that they didn't list you, but there are different criteria, different programs. So I think it's always good to seek out a second opinion. That might be able to be done virtually. You might be able to send the records to them, and the transplant center just reviews it and see if it's worth your time to come there for another evaluation. Or they may be able to do that just, like I say, virtually. I think it's always a good idea.
One of the questions was, how long do you stay in town after a kidney transplant? We tell our patients here at Mayo, Arizona, about 4 to 6 weeks. We usually want you to plan on 6 weeks, and we want you to be within that hour.
Someone wanted us just the fundraising website to go back.
The National Transplant Foundation. I'm not sure which one that was. So the National Foundation for Transplant, and I believe it's National Foundation for Transplants.org. I am not sure on that, so I apologize.
One of the questions was, this must be a person who's been through an evaluation, and they noticed the bone density testing was part of the evaluation process, and they wondered, why is that done? What are the reasons for doing that? I think, bone density is something that in certain types of diseases, like kidney disease or certainly liver disease, bone density can be affected, and osteoporosis is more common in patients with advanced liver disease or stage organ disease. Also, after transplant, we use prednisone or steroids, and for the first few months anyway, and that can decrease bone density. So we want to know what your baseline is going into transplant, because if you have a low bone density, you might be at increased risk of fractures. We want to be able to take precautions to try to prevent that. Another question was, what happens if my doctor finds another health condition when I go in for the evaluation? An example of cancer, would that preclude me from being a transplant candidate? Well, I think the transplant evaluation, as Bev mentioned, is very thorough. We don't leave many stones unturned. We do a lot of testing. The reason for that is that you want to identify any problems that might be there before you get to transplant. After transplant, you're going to be on immune suppression the rest of your life, and so there are potential complications from immune suppression, meaning you increased risk of infection or increased risk of cancer, so we want to know that as well. If we find something during the evaluation, it really kind of depends on what we find. If we do find a cancer, it depends on what type of cancer it is and how likely it is to recur after transplant. There are some cancers that, if they're very superficial or not very significant, we might be able to still move forward with transplant. There are some cancers that we may want you to wait a period of time, maybe 2 years, to be cancer-free before we would want to consider transplant and putting you on immune suppression, which has the potential to increase your recurrence risk. And there are some very serious cancers that you may have to wait even longer or may even preclude you from being a transplant candidate. So it really just kind of depends on the situation.
So one says, my 30-year-old daughter needs a kidney transplant. I'm 64. Could I be a good candidate for a living donor? Certainly, we take 64-year-olds to come in for evaluation. So it's really hard to say. If you, as the mom, want to pursue, then I would encourage you to do so.
So another question came as far as I may be relocating for Transplant Mayo Clinic. the question is about transitioning care back home to the home transplant center after the transplant. And so I think that happens fairly frequently as we get people that come from other states or from different parts of the country. And they may relocate to get their transplant. After the transplant's successful, usually you'll stay in town. It depends on the organ. For liver, it's usually about 3 to 4 weeks. At that point, you go home and we monitor you at home. Usually the transplant center are going to want to keep an eye on you fairly closely for the first 4 to 6 months, maybe the first year. Again, depends on the organ as well.
Right.
But after that period of time, if you have a transplant center that's closer to your home and you want to transfer your care back there, that can be arranged. It's important though that once you've had any kind of organ transplant, that your immune suppression medication is monitored, very closely by an expert, so that those ranges don't get too high to put you at increased risk of infection, but they don't get too low to put you at increased risk of rejection. There's a question about just possible donors are in the process of getting tested. How do I know that they're
evaluating them for a direct donation? So that's a great question. So if you have a donor that's being tested, we almost always start in trying to pursue direct donation, and if that's what the donor has asked. Sometimes the donor will say that they would like to pursue paired, or if they're not eligible to donate directly to the recipient, then they may be offered if they would like to pursue the paired donation. One of the things that's important to remember, and is kind of difficult, I think, for our patients, is that we are required actually by Centers for Medicare and Medicaid to have very separate donor and recipient teams. So a lot of times we cannot tell the recipient that they have donors going through the process. So we keep it very separate. So we keep it very objective for that donor, and we have a lot of guidelines that we need to abide by with that. So you may not know that you have a donor even going through at any given time.
I think it's about the thing about paired donation. I think it's good to kind of talk about that a little bit as well, particularly for kidney transplant. You may already have donors identified, and they may be a match for you, and that may work out. But there is the possibility for paired donation among the Mayo sites or even nationally. And so that may occur if you have a donor who wants to be a donor for you, but they're not a blood type match or they don't match. What can happen is they could donate to somebody else on the list who had a potential donor that didn't match. And then that donor could match with somebody else. And so that could be a paired exchange and allow both recipients to be transplanted that way. There's also chains that occur where somebody has come in and identified that they want to be a donor, and they donate to somebody on the list. And then that person's donor can donate to somebody else. And so there are long chains, sometimes 9 chains or more, that can occur and allow people to get transplanted by this mechanism, by living donation. So that's another important aspect. And with kidneys, sometimes we'll even have altruistic donors,
Right.
Anonymous donors that just want to donate to somebody on the list, and they may come forward in that process as well to start a chain.
Yeah, we often use our altruistic donors starting that chain. So it's a great thing.
There was a question about combined organ transplants. How does that work? And so again, it depends on the situation. Sometimes we'll do maybe a heart-lung transplant. Sometimes we'll do a liver transplant. The patient may need a kidney transplant. There are various combinations, but usually those would come from the same deceased donor. Usually they would get priority depending on the organ that has the highest priority on the list. But it doesn't necessarily change the system. Usually the system is set up so that the appropriate priority is given if you need more than one organ in that situation. I don't think so.
So question is, how long do you stay in town after a kidney transplant? We tell our kidney recipients to plan on 4 to 6 weeks in town. And, certainly if they live in another country, that may be extended. But for the most part, about 4 to 6 weeks.
There's a question as far as who adjusts the medication after transplant, my local nephrologist or transplant center. Again, I think that depends a little bit on the organ that's transplanted. A lot of times with kidney transplant, your local nephrologist will have a fairly good understanding of transplant immune suppression and be able to make those changes. Again, the communication between your referring physician, your local doctor, and the transplant center is a very important one. If there's ever any questions on adjustment, that needs to be communicated and discussed. For other organs like liver, heart, lung, usually the transplant center will kind of manage the immune suppression kind of going forward.
I think too, one of the keys with the immune suppression medication, it's not like a lot of other medications. When I'm on, honestly, to be honest, when I'm on an antibiotic, I may not take the full 10 days and it may not totally affect me. But if I'm on an immunosuppressant drug post-transplant, I cannot even miss one dose. That's what helps the body not attack that new organ. And so it really is key to stay on top of when I take those immunosuppressant drugs and the dosage and getting the refills. So it's really an important aspect.
Absolutely. The time you take it. So a lot of the immune suppression drugs, we measure levels. The levels are timed to be taken usually 12 hours after your last dose. So it's important you take them when you're supposed to take them so we get accurate information, we can adjust those levels. The other important aspect is that a lot of other medications you may take may interact with the immunosuppressive medication. So if you get started on any new medications, it's important to contact usually your transplant center just to let them know. There are some antibiotics, there are some other kinds of medications that may make your levels higher or lower, and we need to know that information so we can adjust it appropriately. One question, I'm waiting for a kidney transplant. If I get a cold, can I still receive a transplant? And so I think that's a good question. I think if the donor becomes available, the transplant center will call you. They'll ask how your general health is. Have you been in the hospital recently? If it's a minor cold and you're recovering, they may be able to still go through the transplant. But if you've had a major illness or if you have an active infection, a bacterial infection, then you wouldn't want to go through a transplant at that time, just because you're going to be on immune suppressive medications, particularly higher doses right after transplant, and that would increase the risk of infection. So if you have an active infection, that would usually be a reason to postpone the transplant or wait until another time. Another question just came in. I'm already listed at another center. Do you take the tests if they're current or do your own testing? That's a very good question. So if you've had a full evaluation at another transplant center, usually we'll take that information and review it because a lot of those tests are not going to change. There are some tests that might need to be updated. If it's been a while since you've had a heart stress test, you may need to have an updated version of that. For liver testing, every 6 months we do cancer surveillance looking for liver cancer. So some of those tests might need to be updated. But for the most part, if you've had recent tests, those can be used and utilized for the evaluation.
They will still, though, go through our evaluation in the sense of meeting with our physician, meeting with the surgeon, the social worker, going to our education classes, meeting with a dietitian. They will still continue to do all that.
And that's very important because the relationship you build with your team, with the transplant center, and all those people is really important.
Is there an upper age limit for a kidney transplant recipient? Honestly, here at Mayo Clinic, Arizona, we really don't have an upper age limit. As I'm sure you all would agree with anymore, sometimes we see 60-year-olds who may look like 80 and 80-year-olds who may look like 60. So we don't really put an upper limit necessarily on that. It really is about their health. Would you agree?
Yeah. I think it may depend on the organ that we're talking about.
Right.
For liver, we do have an upper age limit of 60 because it's a bigger surgery, donating a portion of your liver than a kidney. But I think also every program may have their own guidelines, and so that's where I think it's important to talk with the program that you're listed at, or if you're looking at another program, find out kind of what their guidelines are, because they may vary from program to program and from organ to organ.
Yeah, I agree with that.
But again, I think the most important thing for being a living donor is that the program's going to first assess the safety to you, the safety to the donor. If they don't think it's safe to move ahead, then they won't proceed. And so the donors go through an evaluation much like what a recipient goes through. It's a very thorough evaluation. For liver transplant, again, it's a little, the risk of the surgery a little bit higher. Only about half the people who want to be a donor actually qualify. For kidney, it may be a little bit obviously higher. but the donor safety is the first priority.
And because it's an optional surgery, we're not only looking at medical, but we're also looking at, you know, how does it impact that donor financially? You know, do they have family support? If a spouse is adamant that they would not pursue, you know, we'll probably have some conversations. So we're looking at the whole picture with our donors to make sure that it is in their well-being to continue.
We're getting close to time. I hope that you found this helpful. I hope that you've gotten some of your questions answered. I hope you'll go to the SRTR website on your own and spend more time trying to navigate through that. There will be a recording of this session, so if you missed part of it or if you have friends that might want to see it, tell them about it, and the recording will be available on the Mayo Connect. If you have additional questions that didn't get answered during this, please submit them. We'll try to answer those and put them up on the website as well. So again, for both of us, thank you very much.
Thank you.